do you deal with the pressure of being a nurse, of the demand of being a content creator? How do you balance that in terms of your mental health?
Working as a nurse, there's work pressure. I mean, you are looking after people's lives, and there are days that you'll feel like you haven't done enough for your patients, and there are days that you're happy that you're able to save people's life. I've been in situations where I've been the savior of people, and it makes me so happy. And then on days like that, I just feel like fulfilled being in this profession. Talking about balancing content creation and my work, and so for me, I always plan ahead so that I still have some time for myself. There are times that you will feel overwhelmed, and when it gets to that point, take a break. Social media is not going to save you from any mental problems. You need to understand that if you're not in your right state of mind, you cannot give out quality content. So for you to be able to give out quality content, you have to have a quality life. So if there's no life, if there's no quality in your life, you cannot give out anything quality. It's what you have that you're going to give.
Happy International Women's Day to every mother, every daughter, and every child out there. Today should be a day of inflection or reflection where people think about the inequalities that still occur in our society against women. Today I've got with me a woman of timber and caliber, a woman extraordinaire. She's a good friend of mine, someone I could see that is a strong person, an excellent human being to the core. Today I have Temitope, a person with me. Good to have you on the show finally.
Thank you so much for having me. Hi everyone. My name is Temitope Ayomide. I'm a registered nurse. I work in cardiothoracic surgery and transplant. And I'm a content creator. I'm also a fragrance enthusiast. And yeah, I just like having fun, creating memories. And yeah, that's it.
Oh, that's really good. And if you need any recommendation about what perfume you need to get,
yeah, you can reach out to me
to shout out to. And we'll add TikTok accounts to the comments so you could probably like follow her.
Thank you.
Okay, today we've got something really interesting. Before I continue, Happy International Women's Day.
Oh, thank you very much.
So today, the topic we'll be discussing or delving into is about women's general health. A lot of things women overlook. They just think, oh, it's gonna go, it's all right, and when they eventually like try to take care of it, it's become something really palliative in some sense. Do you have any advice for any woman out there having or neglecting their health? Do you have any advice for any woman out there neglecting their health? And what would you say, this is something you need to look into? This is something you should do to improve your well-being?
Okay. I'm going to speak from a personal perspective. So you don't have to take me for my words, but at the same time, I think this would help as much people as possible. So I think the first thing as a lady is you have to be hygienic. Like you have to be clean as much as possible. Your personal space needs to be clean. Your kitchen needs to be clean. Your clothes, your makeup brushes, your towels. It's very important that you're hygiene. I think like this popular saying, cleanliness is next to godliness. I think cleanliness is very important. You have to be hygienic. And hand washing, I think that is very important. You don't just go around touching things and then you touch your face with that same hand, or you put the same hand in your mouth, or you use the same hand to eat. I think it's very important you take your hand hygiene seriously. You cannot be too clean. So you always have to be on top of your hygiene. For me, I always go around with hand sanitizer in my bag, and there's this wipes, antibacterial wipes I always have in my bag. You just go out, you shake people, you don't know where they've touched, and then you use that same hand, they give you food, you put it in your mouth. You need to always like have like a small hand sanitizers in your bag. And I think that's one thing. If you get to a place where you can wash your hands, if you, there's a sink or anywhere you can wash your hands, try to wash your hands. And as a lady, I feel like your body will always tell you something. If anything is wrong, your body will always tell you. You wake up in the morning, you notice like maybe acne, or you notice like a swelling in a part of your body. That is a sign that something is probably not right, and you should not ignore it. These are things that you should not take slightly. You can just wake up with a very bad headache, or you should not just assume that, oh, it's because I didn't sleep well, or it's because I was awake all night. You should, I mean, it doesn't have to necessarily be something serious, but then don't just overlook it and think, oh, it's just going to go away like that. We have to take our health like seriously. Another thing is going for regular checkups. Like you just randomly just check your blood glucose, check your blood pressure, do an ECG, do like pap smear, do like, and then there are vaccines that we can take to prevent some diseases from happening. Take different vaccines that you can take as much as possible. And also your skin is very important. You need to take care of your skin. See, if you have to see a dermatologist, let them recommend products for you. Don't just do like trial and error with different products. Your skin is very important. You don't just throw everything you see on your skin. And also food. I think we have to mind what we eat. I know like people don't really care about what they eat these days, but then it's very important. The food we eat is like, okay, I think the last time I saw an esthetician, they told me that your skin health starts from within. So your gut health would determine what your skin looks like. So whatever you put in is what is going to show on the outside. So if you keep eating all these junks and think, oh, you'll be fine, trust me, you're not going to be fine. It will get to a point where you would see the result of all these things you're consuming. And also fitness. You don't necessarily have to go to the gym. You don't necessarily have to do 10k steps a day. If you can, it's all fine and good. But if you cannot, just do what you can. Stay active, like be very active. You're eating all this food, you're consuming all this glucose. You need to burn them. So you have to be active. You have to make yourself active. If you work from home, take breaks from time to time. Walk, take a 5-minute walk, 10-minute walk. All of this adds up and they make a change in your life and in your health.
Thank you very much for that's a really wonderful insight to talk about women's general well-being. And I think you've really covered everything, right from the outward appearance down to what we eat and how to help improve our health. Then the next thing I want to ask you, there's a lot of things you hear nowadays about people complaining about hormonal imbalance. Do you have any suggestion or any advice for anyone suffering from hormonal imbalance?
As women, we have different hormones and you don't have control over these things. And yeah, when people say, oh, they have hormonal imbalance or their hormones, or they say their hormones are making them act in certain ways, I mean, it might not be the hormones, but then if you have not confirmed that it's not the hormones, don't rule out what they have said. Don't just say, oh, it's not valid. Anything they say is happening, just take it for what they have said it is. And yes, I mean, from personal experience, there are some times that I would actually do some things that at the moment I might not see it as something wrong, but then when I'm calm, and then I would see that, oh, maybe I actually overreacted, and then I look at what time of the month I'm in. I'm like, oh, maybe it's because of this. But then that doesn't still justify bad behaviors. So we should not always put our bad behaviors on hormones. Yes, there's that, but also, I mean, my advice to anybody experiencing hormonal imbalance is to see a specialist. There's no two way about it. You just have to see a specialist, and they can recommend if you have to take some medications, if you have to do some more investigations to confirm what exactly is wrong. You cannot treat hormonal imbalance in your home or on social media. You just have to see a specialist. That's my advice.
That's very astute. I've got a friend a while back. She was lactating. Lactating means her breast is bringing out milk. She wasn't pregnant. she was not nursing a baby, but her breast was bringing out milk. Initially, it was small. Then she like shrugged it off, like there was nothing wrong. Then it started becoming a lot of breast milk coming out, and she went to the hospital, and it's really good. The advice you said about visiting a specialist.
I think I have somebody, like, I mean, someone really close to me then, like, that was like over 10 years ago. I can't remember. I think I was still in nursing school when this happened. And the person was like, oh, it's happened. I actually saw it. Like, the person showed me, and I was like, oh, I didn't know that this could happen if you're not pregnant or when you have a baby. I'm like, it's strange to me. I mean, I'm just in year 1 or year 2, so I didn't know much about that. And the person said, oh, I was like, oh, so what have you done? And the person was like, oh, she's using one agbo. I'm like, okay. I mean, even before I became a nurse, I'm anti-agbo.
Agbo? Say what agbo is. Tell her.
Okay, agbo is all this herbal concoction. I am anti-herbal, anti-herbs. I'm so anti anything concoction, whatever that is. I'm anti everything herbs. So I'm like, huh? Like, this is not going to, I don't think this would, I mean, it might be, you might think it's working, but I would suggest that you actually go to the hospital and you should check yourself out, because this doesn't look normal to me. And I don't think I've seen anything like this before. And then the next time I saw her breast was actually looking bigger. It was really swollen because she didn't take my advice, obviously. And she was still taking the herb. And I still gave her the same advice. Go to the hospital. She was like, oh, auntie nurse. I'm not auntie nurse. Nobody knows what I do in my neighborhood, because I'm just trying to protect myself and protect my license. I mean, this was back in Nigeria. I don't tell people what I do because I know how the society would take advantage of the fact that you're a nurse, and they will bring different things to you, and they'll say, oh, you have to treat them, and if you don't, they take it too personal. And I'm like, I can't deal with anything in my father's house. You have to go to the hospital. Even my siblings, my parents, I don't do anything with them. And if anything is wrong with you, you go to the hospital. So I told her then, and I think that was the last I heard from this person. I left that environment and I never hear from her. I don't know if she's fine now. I don't even know if she was, but yeah, I did give her my advice. I don't know if she eventually followed it. But yeah, you just have to see a specialist, really.
Thank you for that. Probably would go into that in another day. We'll leave that for another day to discuss that. I've got a question to ask you. You're a nurse, you're a content creator, or an enthusiast, a frag enthusiast, or frag head, as some people call it.
Yeah, frag head.
How do you deal with the pressure of being a nurse, of the demand of being a content creator? How do you balance that in terms of your mental health? Because nowadays, the generation we're living, there's so much importance placed on it, which is quite alright. Everybody's aware of what triggers them, what's the problem, how to deal with it. A lot of people find it really difficult to like balance the pressure at work and being a content creator. How would you advise someone that is dealing with that pressure?
Okay, I'm not going to lie and say that it's all rosy, all easy. Trust me, there are days that I'm just like, you know what, I'm not going to do this content thing today. I'm not going to post anything today. Whatever happens. It's not going to stop me from being who I think I am. So I'm like, yeah, there are days that you feel so overwhelmed. There was a time last year I actually took a break from everything, from work, from content, from everything. I was like, I just needed my alone time. I wasn't posting anything. I wasn't recording anything. I didn't go to work. Also, I took a break from work. I told them I needed like few days. I took actually about 8 days away from work. I'm like, I need to like reflect on myself and take my time and refresh myself and re-energize. So you get to a point where you feel overwhelmed. Working as a nurse, there's work pressure. I mean, you are looking after people's lives, and there are days that you'll feel like you haven't done enough for your patients, and there are days that you're happy that you're able to save people's life. I've been in situations where I've been the savior of people, and it makes me so happy. And then on days like that, I just feel like fulfilled being in this profession. Talking about balancing content creation and my work. And so for me, I always plan ahead so that I still have some times for myself. So I do like this thing we call batch creating. So you can use a whole day creating content, editing, and all of that stuff, and then maybe for the next 2 days you're not shooting anything. For the next 1 week you're not shooting anything. Like now, I have enough content till next week. I have enough content for the whole of this week. If I don't want to shoot any more content, even if I should, that would be like extra. So I feel like there are times that you will feel overwhelmed, and when it gets to that point, take a break. Social media is not going to save you from any mental problems. If you feel like you're doing it, I know like people enjoy creating content, but at the same time the enjoyment sometimes will disappear and you need that break. But some people just feel like, oh, I have to show up every day because there are people looking up to me, there are brands looking up to me. How will brand notice me if I don't do this? How would they come to me? How would they work with me if I don't do this every day? But then you need to understand that if you're not in your right state of mind, you cannot give out quality content. So for you to be able to give out quality content, you have to have a quality life. It is what you have that you're going to give. So if you don't have happiness, you cannot give happiness. So you have to be happy in yourself. You have to look after yourself before you can be able to give out what you think people would like.
Okay. There are some people that say, "Oh, fake it till you make it." Like in terms of happiness, you've seen a lot of people, especially our age group. They say, "Oh, you fake it till you make it." You see a lot of them outside. They are smiling. Then the next day or next week, you just hear, "Oh, this person committed suicide." What would you say to such person that is struggling with mental health? Do you advise or therapy, or what would you advise?
So for me, I have a contrary opinion.
Okay.
And my opinion is that you cannot fake happiness. I don't know if there are people that can actually do it, but I don't think it's something realistic that you actually fake happiness.
But you've seen probably celebrities say, "Oh, you guys see me outside, I must perform, I must do this, I must do that," while they are struggling with depression.
That's the thing. Like nobody cares. Like if anything is wrong with you, apart from maybe people that actually cares about you and people that are close to you. You see, people on social media and the rest of the world, they don't care about whatever is going on with you. As long as you are entertaining them and they are entertained, that is all they care about. Whatever is happening in your life, nobody cares. So if you decide to ignore your life just to entertain people, then that is on you. So you have to look, like I said, you have to look after yourself. You have to have a quality life before you can give whatever people want from you. And people do not care about whatever is going on in your life. They just care about their own entertainment. They just want to see whatever is going on in your life. You know, some people feed off your energy online. Some people's life depend on what you post online. People are actually living through some of these celebrities, and that is why they would be like, oh, they just want to see the good parts, because nobody wants anything bad in their life. So when you come about, oh, you are this, you are that, nobody cares to listen, because they don't, that is not what they want to see from you, because they want all the good side and all the happiness. But if you're feeling down, take time off. Like I've seen people like take time off social media, then went back to do a lot of they took their time. If you have to get therapy, get therapy. Therapy is good. Go for therapy. You don't even have to.
Some people say black people don't do therapy.
There was a time I didn't eventually see the psychologist, but I almost saw a psychologist last year because I was going through a rough patch, and I was like, yeah, I just feel like I'm losing my mind. But I took a break and everything just came back. I just feel like, oh, maybe I just needed a break. But I actually signed up for seeing a psychologist. But then when I took the break and I saw that, oh, maybe this is what I just needed. And I was like, oh, I don't think I need this anymore. And I was like, if I ever feel like this again, maybe I then need to see the psychologist. So if you need to, anything that you need to do to bring yourself back to who you really are, just do it. If it's therapy, do it. If you need to take a break, do it. If you need to cut people off, do it. If you need to delete your social, yes. If you need to cut people off, do it. If you need to like delete your social media, do it. There was a time I deleted all my social media applications because yes, I needed myself. I needed to come back to myself. If you need to do all these things, just do them. If you need to block people, block them. If it's going to bring you happiness, if it's going to bring you peace of mind, do it.
Yeah, I think from what I could gather and everything you shared, choose you. In all things, choose you.
Exactly. Choose yourself. Like nobody's going to choose you over them. Choose yourself all the time. Like you are the most important person to yourself. You are the most important person on earth as long as you're concerned. As far as you're concerned, you are very important. So nobody is going to come and choose you. You have to choose yourself and prioritize yourself.
Definitely. I've also had an experience. I had to speak to. I had multiple sessions with a therapist to just discuss about what was going on, and it got better. But for me, as a person of faith, after speaking to a therapist, I sit down to God to help me through whatever I'm going through, and it's always worked for me. All right. Just to round up, for little Temitopes out there trying to like go on go on with their life, trying to sort out what they want to be, and they are just growing into the type of women they are. I'm not saying you figured out who you are. No. Everybody keep discovering themselves. So do you have any advice for anybody watching out there trying to like find their fate, struggling, saying, oh, will he always be this way? Will he always finish? When will I know this is what I want to do? When will things get better? Or how do I decide to become the type of woman I want to be? Because I'm sure a lot of people see you as a role model, and there's a lot of people that see you as a role model. So I'm sure, to be honest, there will be a lot of people that see you as a role model. Like you said, a lot of people see people online and see what they are.
Yeah.
They don't see the behind the scene. They just see what's online, and they'll be like, I want to be like this person. What would be your advice to people that, oh, I want to see this, I want to be like this person? What can they do? Not just the superficial part of I want to be like this person. What about the awesomeness of that person? Do you have any advice?
Okay, I'm not a motivational speaker, but yeah, I think one thing I would say is you can be anything you want to be. It just depends on how much work you're ready to put in. So if you want to be anything, just put in the work and just, I mean, it might take time. There might be some obstacles, there might be some difficulties on the way, but you just have to be determined, like determination, dedication, and you just have to keep fighting. Like, I'm still becoming. I'm not yet who I want to be. I'm still becoming, and every day I wake up, I'm like, yes, this is where I'm going, and I'm just, every day is a step towards what I want to become. And I feel like just take it a step at a time. Don't look at people around you. I mean, you should have people you look up to, and you'll be like, oh, I want to be like this person. But then don't make your whole determination, or don't make your whole personality about becoming someone else. You can use them as role models, you can use them as examples, but do not make them, like, do not see them as gods. And don't say, oh, if I don't be like this person, then that's the end for me. No. You can be your own person. You can be the first of your own person. And I feel like, yes, like I said, determination, dedication, and don't let peer pressure consume you. Because there's so much going on social media. There's a lot of things we see these days to be like, oh, why can I not be like this person? Why can I not be like this person? Just really, like, you don't know what is happening in everybody's life. You don't know where everyone is coming from. We are all from different backgrounds, and we cannot all be the same. So just keep being you, keep putting in the work, and trust in God. Yes, put God first in everything that you do. I mean, that's what I've been doing all my life. I've always trusted in God, and He has always directed my path. Everything I want to do, I always put it to God. God has always directed me. I never thought I would be a nurse. That is not what I wanted to be. But I just feel like God directed me to where I am today. And I think I'm grateful to God, because if I didn't study nursing, I don't think I would be here right now. Like, I don't think I would be sitting here right now. I don't think I would be where I am today. I'm so grateful that I actually listened and I didn't throw away God's words. And so, yeah, put God first in everything that you do, and it's going to direct your path.
Thank you very much for that advice for people. That's been it's been a really mind-opening episode. So finally, what will be your final charge to women all over the world watching us?
Okay, so to wrap up this podcast, I'm going to say, like I mentioned earlier, hand hygiene, go for regular checkups, prioritize your health, prioritize yourself as well, mind what you eat healthy, eat clean, fitness, make sure you walk as much as possible, stay active, take the vaccines, and take your multivitamins, like take your vitamins, take your supplements, and yes, prioritize yourself and make sure to look after yourself. It's very important.
Thank you very much. For some of you that don't know, Temitope is one of the brains behind this podcast and helping us move it as it's going every day. Thank you very much for joining us today, and hopefully we'll see you some other time to come onto the podcast. Hopefully you decide to come. Thank you very much everyone for watching this. Don't forget to subscribe, like, comment, and follow us on all our social media pages. Until next time, remember, your health is your wealth, your health is your power, and your health is one. Thank you.
And thank you so much for having me. Keep watching Vital Science Podcast.